section is on obesity and metabolic syndrome. The definition of obesity and overweight can be described by using the body mass index, which is a simple equation of the weight in kilograms divided by the height in meters squared. This use of the BMI is a simple way of evaluating obesity for the general population. It does not give you a perspective of percent body fat, but for the general population it does give you an indication of health risk. And with the most cases, having an elevated BMI is associated with a buildup of body fat. And it is a combination of excess total calories and a sedentary lifestyle. And if we look at the stateofobesity.org and look at the incidence, we'll find what states are at highest level, and majority of them are in the lower part of the country, in the south area, the southern states. With looking at body mass index, you can do an evaluation of or classification of underweight, normal, overweight, and obese. And having a body mass index between the 18.5 and 24.9 is identified as normal. And often people will get in this field will think, well, if that's normal, then lower is better. And that's when we run into a case of individuals who have potential eating disorders or diseases such as cancer, where a person could have extreme weight loss due to inability to thrive, basically. So less than 18.5 is certainly not desirable. The desirable range is listed in the table. The recent statistics indicate that approximately 70% of all American adults fall in the overweight to morbidly obese category. And if we were to look at what the morbid obesity group is, that's about 7% of all Americans. This is the most recent data. And note that you have a classification of 1, 2, and 3 in obesity. If we look at youth, there's an indication that 32% of children and adolescents are overweight and obese. And why we need to look at this by itself is that it is a risk. It's linked. Obesity and overweight is linked to numerous chronic diseases, including diabetes, some forms of cancer, musculoskeletal problems such as arthritis, and cardiovascular disease as the most prevalent. For cause and effect, there's an article that had a really nice visual that I thought was worthwhile to look at. And actually, this particular article is looking at prevalence of behaviors in children that are linked to obesity as adults. And on the left-hand side, we can see the causes of obesity and then the effects with a variety of diseases that are linked to obesity. What is not shown is a lack of sleep, which has recently been indicated as a very good link, or having a strong link to obesity. And the sleep deprivation has been how that's linked to obesity, is that you have a decrease in leptin and an increase in ghrelin. And with those two hormones, hunger increases, and also if somebody is not sleeping, there's an increased opportunity to eat, and that increases in the caloric intake. Also, a person is really fatigued and most likely has an increase of some stress hormones, and that's going to kind of make someone feel like they eat mindlessly, I guess you could say. And those factors are partially to explain, or the basic just explanation of the link. The complications of obesity are many, and it's estimated that obesity-related conditions account for about 7% of the total healthcare costs in the United States, and these are basically direct and indirect costs associated with this, and this could be approximately $190 billion annually. So we're going to take a look at some of these. I do have a couple that I haven't looked at in more detail, but you'll see that the list of cancer, breast, uterine, colon, esophageal, pancreas, kidney, and prostate, fatty liver disease, certain lung diseases, pancreatitis, certain components with women, and abnormal periods or infertility. You could also put polycystic ovary disease, sleeping, snoring, and cardiovascular disease. So there are a number of complications. On the cardiovascular system, we do know that obesity is an independent risk factor, and it is associated with increased blood pressure or hypertension and body mass index. And this is thought to be, the increased risk is thought to be associated with a low-grade inflammatory response associated with obesity. And this leads to some altered changes which can contribute to an increased risk of metabolic syndrome, which has to do with a glucose, insulin sensitivity, and altered fat metabolism. Pulmonary system, you have potential for increased weight on the lungs themselves, which can make it difficult for stretching of the lungs, and that's like reduced lung compliance. Lung volumes can be decreased, the muscles can become weaker, and you can have altered ventilation within the lungs themselves. And this results in exercise intolerance, shortness of breath, and also the sleep apnea, which is actually really highly linked to cardiovascular disease or increased risk of heart attack, and some pulmonary diseases such as asthma. With the musculoskeletal system, there are various, or both primary arthritis types are associated with obesity, and I think it's interesting that there's an association or a relationship with rheumatoid severity, and also with certain, it's a risk factor for development of like knee, hip, back arthritis. There's also some other issues, and you wouldn't think of the carpal tunnel syndrome, but that is one. Problems with the feet, such as plantar fasciitis, and back pain, especially with low back pain, because of associated with a very large abdomen and a change in the center of gravity and increased pressure on the spine itself. With the endocrine system, the leptin receptors, as you have an increased amount of weight, there might be an insufficiency of leptin receptors. They become insensitive, and that causes an increase in appetite and also insulin resistance, where a person is at greater risk for having a diagnosis of type 2 diabetes. I have a video to look at about insulin resistance that I hope you take a look at. For a person's ADLs, there are a number of signs and symptoms that a person might describe, which alters their inability to feel fully functional, and a low level of energy, not feeling, and this goes back to depression, shortness of breath. A person might have shortness of breath doing daily activities, and so there is definitely an decrease in functional capacity for individuals. On exercise, we have a couple issues that I've highlighted, and one is increased fatigue and joint discomfort. We have to be conscientious about the increased impact on the joints. We also have a decrease in strength, and there's just during exercise, a person might have more discomfort in their feet. They might have need to be exercising at a lower, they might have to start at a lower volume because they can't achieve what's necessary for meaningful weight loss. For obesity, and especially obesity and also overweight, there's a sustained weight loss of 3 to 5% is likely to result in meaningful clinical reductions in triglycerides, blood glucose, and HbA1c levels, or hemoglobin, glycolated hemoglobin levels, and also the risk basically of developing type 2 diabetes. So a 3 to 5% decrease in weight loss can have a really significant health impact for the individual. It does appear that it's not uncommon for a person to have some weight gain after they stop their weight loss treatment program. And when a person initially starts to lose weight, that the energy intake and energy expenditure combination is responsible for 5 to 10%, a 5 to 10% reduction in body weight. Now, physical activity is really more modest of an impact when a person starts their weight loss journey, and I hate that expression, their weight loss path, and it's more important to, or the bigger impact is energy impact, or energy intake, excuse me. And when you have moderate reductions in energy intake with adequate levels of physical activity, there seems to be a really good impact on weight loss.